Nursing Officer, previous year question paper. Question number 1. Percentage of oxygen delivered by use of a non-rebreathing mask with a flow rate of 10 liters per minute is? Correct answer is 90 to 95. Second question. Simple or typical febrile seizures occur in? Correct answer is option B, 3 months to 5 years. Question number 3. The dilution of adrenaline used in neonatal resuscitation is? Correct answer is option D, 1:10,000. Fourth question. Injection sodium bicarbonate should not be mixed with? Correct answer is option C, calcium gluconate. Question number 5. Weight and length of a normal full-term baby with birth weight of 3 kg at 1 year of age are expected to be? Correct answer is option B, 9 kg and 75 centimeter. Question number 6. Using a placebo for pain control in a certain case without the patient's consent is? Option D, deceptive and unethical. Question number 7. Which of the following can be used for applying moist heat? Correct answer is option A, sitz bath. Question number 8. Which action is most effective in preventing wound infections? Correct answer is option D, observing careful hand hygiene. Question number 9. Before administering enteric coated drug through a nasogastric tube, the nurse should first ensure? Option C, checking for proper placement of the tube. Question number 10. Maslow's hierarchy of basic human needs is useful when planning and implementing nursing care as it provides a structure for? Correct answer is option B, establishing priorities of care. Question number 11. Which nursing organization was the first international organization of women nurses? Correct answer option A, the International Council of Nurses, ICN. Question number 12. Total parenteral nutrition, TPN, is administered through a central vein because of? Correct answer option C, high osmolarity of solution. Question number 13. Gas gangrene is caused by? Option C, Clostridium perfringens. Question number 14. Most important step in avoiding wrong side surgery is? Option A, having a checklist procedure before surgery. Question number 15. Transmission of HIV to healthcare workers during surgery can be prevented by? Option B, using universal precautions. Question number 16. Accurate estimation of large burn areas is done by? Correct answer option C, London Browder chart. Question number 17. Most common topical treatment used for burn wounds which is effective against both Pseudomonas and MRSA is? Correct answer option A, silver sulfidase. silver sulfadiazine. Question number 18. Best and easy way to monitor resuscitation in a burn patient is? Correct answer is option C. Monitoring urine output. Question number 19. Lucid interval is seen in? Correct answer option B. Extradural hemorrhage. Question number 20. All the following suture materials are absorbable except? Answer is option C. Polypropylene, proline. Question number 21. A patient with diabetes insipidus characteristically complained of? Correct answer is option C. Thirst. Question number 22. The fluid preferred for initial resuscitation of a patient with hemorrhage shock is? Correct answer is option A. Ringer's lactate. Question number 23. Nectalophia and Bitot spot are due to deficiency of? Correct answer is option A. Vitamin A. 24. 1 pint of 10% dextrose yields how much of calories? Correct answer is option B. 200. Question number 25. The thick collection of nerve fibers that connects the two hemispheres of the brain is called? Correct answer is option A. Corpus callosum. 26. Goidal airway is a? Correct answer is option A. Oropharyngeal airway. Question number 27. All of the following are complications of immobility except? Correct answer is option D. Hepatic failure. Question number 28. Which of the following represents leg 3 of electrocardiography? Correct answer is option B. Left leg to left arm. Question number 29. In Trendelenburg position, correct answer is A. The foot end of the bed is elevated. Question number 30. Gastric lavage should not be done in? Correct answer is option B. Corrosive poisoning. Question number 31. Which of the following clinical nursing practices is recommended as most important to healthcare and nursing professional today? Correct answer is option D. Evidence-based practice. Question number 32. The oral clinical thermometer records the temperature of 102 degree Fahrenheit in a patient scheduled for surgery, but the patient is afraid to touch. The first thing to be done by the recording nurse is to? Option C. Validate the findings. Question number 33. Which route 1 uses to identify hypothermia in a newborn? Correct answer is option C. Rectal. Question number 34. A known admitted cardiac patient develops dyspnea. What should the attending nurse do first before other activities? Correct answer is option D. Keep the patient in propped up position. Question number 35. In the critical care pain observation tool, which facial expression has been given the score of 2? Correct answer is option C, grimacing. Question number 36. Which method of documentation uses the categories data, action and response DAR to facilitate nurse daily charting? Correct answer is option B, focus charting. Question number 35. When implementing the plan of care for a patient receiving intravenous therapy, which nursing practice would be most appropriate? Correct answer is option D, monitoring the flow rate once every hour. Question number 38. While administering a blood transfusion, the ideal nursing care recommended to identify a blood transfusion reaction is? Correct answer is option C, inspecting once in every 30 minutes. Question number 39. When caring for a patient with chronic lung disease on oxygen therapy by nasal cannula, the most important check that is expected of the nurse is? Correct answer is option B. The rate will be 2 liters per minute or less. Question number 40. Which nursing action is inappropriate when performing oropharyngeal suctioning on a patient? Correct answer is option B, applying suction as a catheter is being introduced. Question number 41. Dilated pupil could result from? Correct answer is option D, brain death. Question number 42. Rest is needed in patient with coronary artery disease to? Option B, reduce oxygen requirements of the body. Question number 43. Myasthenia gravis is a disease of? Correct answer is option A, neuromuscular junction. Question number 44. Parkinson's disease is characterized by the following except? Correct answer is uniform spasticity. 45. One of the following drugs cannot be used in hypertension management. Cannot be used in hypertension. Correct answer is option B, dopamine. Question number 46. The typical ECG pattern of acute myocardial infarction. Correct answer is option B, ST segment elevation. Question number 47. One of the following drugs is used to lower blood cholesterol. Correct answer is option D, atorvastatin. Question number 48. One of the following is an antiplatelet drug. Correct answer is option C, aspirin. Question number 49. The drug that is used to treat a cyanotic spell in a child is? Correct answer is option A, morphine. Question number 50. The supportive cells of the nervous system are? Correct answer option C, glial cells. Question number 51. A 35-year-old smoker with gangrene toe most probably suffers from, correct answer is option A, thromboangiitis obliterans. Question number 52. Nursing activities shown to potentially increase intracranial pressure include, correct answer is option C, endotracheal suctioning. 53. The treatment of mitral stenosis is, option A, balloon valvotomy. 54. One of the following is a new test used in acute chest pain. Correct answer is option B, troponin T or eye estimation. 55. The nurse should expect a patient who has chronic renal failure to be given erythropoietin epogen to, correct answer is option D, stimulate the synthesis of red blood cells. Question number 56. When teaching the caregivers of a patient who has dementia of the Alzheimer's type, a nurse should stress the importance of, correct answer is option B, a predictable environment. Question number 57. Which of the following blood values on the laboratory report should a nurse expect when assessing a patient who has emphysema? Correct answer is option A, PCO2 52 mmHg. Question number 58. Which of the following conditions would a nurse recognize as contributing to the development of respiratory acidosis? Correct answer is option A, COPD. Next, 59. Which of the following outcomes observed by the nurse during the drain cycle of peritoneal dialysis should be reported immediately to the physician? Correct answer is option B, cloudy output. Next, question number 60. Which of the following foods should be removed from the dietary tray of a patient who has hepatic encephalopathy? Correct answer is option D, X. 61. Which of the following findings would a nurse identify as indicative of septic shock in a patient? Correct answer is option C, cool, clammy skin. Question number 62. The nurse should instruct a patient who is to receive digoxin, lanoxin to report development of which of the following side effects? Correct answer is option B, loss of appetite. Question number 63. Enteric fever is transmitted by, correct answer is option C, inoculation. Question number 64. Nursing care for a patient who has polycythemia vera would focus on preventing, correct answer is option C, thrombosis. Question number 65. The length of the spinal cord in an adult male is, correct answer is 45 centimeter, option B, 45 centimeter. Question number 66. When caring for a patient who is on a mechanical ventilator, the nurse should monitor the patient for which of the following complications? Correct answer is option C, pneumothorax. Question number 67. Broca area controls, correct answer is option B, speech. Question number 68. Who invented the blood grouping as ABO? Correct answer is option A, Landsteiner. Question number 69. Which of the following vitamin is soluble in water? Correct answer is option C, Question number 70. How many lobes are present in right lung? Correct answer is option C, 3. Question number 71. Which plane divides the brain into unequal right and left portions? Correct answer is option D, parasagittal plane. Question number 72. Which channels are opened during depolarization in metabolism? Correct answer is option B, Na+. Question number 73. What is the outermost layer of a heart called? 73. Option B is the correct answer. Epicardium. Option B, epicardium. Outermost layer of heart. 74. Cholesterol is important in the human body for? Correct answer is option B, cell membrane structure. Cell membrane structure. Question number 75. In the PQRS waves in ECG, P wave represent? Correct answer is option A, atrial depolarization. P wave represent atrial depolarization. 76. To calculate cardiac output, heart rate is multiplied with? Correct answer is option A, stroke volume. In which organ, 77, in which organ are the Kupffer cells present? Correct answer is option C, liver. Liver. 78. Gonads means? Gonads means? Correct answer is option D, testes and ovaries. Gonads means testes and ovaries. Question number 79. In protein classification, class A protein are? Correct answer is option A, animal proteins. In protein classification, class A proteins are animal proteins. Question number 80. What is the scientific name of vitamin B6? Correct answer is option B, pyridoxine. Vitamin B6, pyridoxine.